Insomnia is a diagnosed sleep disorder characterized by the inability to fall and stay asleep. Today, there are multiple prescriptions available to treat insomnia-like symptoms. Insomnia does not have to rule your life any longer. Lorazepam is a benzodiazepine that affects chemicals in the brain that may be unbalanced. Lorazepam is commonly used to treat anxiety but can help with insomnia-like symptoms. Due to its addictive effect, it is recommended to only use lorazepam for short-term use. Doxepin is a tricyclic antidepressant used for people who have difficulty staying asleep. Doxepin works by blocking the effects of histamine in the brain. It is recommended to take doxepin on an empty stomach right before bed. Trazodone is an antidepressant of the serotonin antagonist and reuptake inhibitor class. Trazodone, in combination with its anti-anxiety abilities, has the capabilities of sleep-inducing effects. Lunesta is a non-benzodiazepine sedative hypnotic that balances chemicals in the brain to help people fall and stay asleep for the full 8 hours. Lunesta acts quickly, so take right before bed. Ambien is a sedative hypnotic that acts on the brain to produce a calming effect. Ambien is a 2-layer pill. The first layer dissolves quickly to help you fall asleep, and the second layer dissolves slowly to help you stay asleep.
Side effects of these drugs may include bleeding gums, blindness, dull, blurred vision, slurred speech, hives, hyperventilation, drowsiness, abdominal pain, anxiety attacks, aggression, chills, confusion, difficulty breathing, dry mouth, irregular heartbeat, increased breathing problems, muscle cramps, memory problems, hallucinations, sore throat, bad breath, yellow eyes or skin, depersonalization, strokes, convulsions, or coma.
Talk to your doctor today to see if any of these medications are right for you and can be used in combination with other forms of insomnia treatments. Do you have difficulty falling asleep at night and toss and turn for what seems like hours? Do you have difficulty staying asleep throughout the night? Do you find yourself waking up in the morning without feeling refreshed? Do you experience excessive daytime drowsiness? If so, you may be experiencing symptoms of insomnia caused by stress, anxiety, and depression. Introducing Sleep Hygiene, the #1 doctor-recommended treatment for insomnia. There are many ways to practice proper sleep hygiene. One is to stay away from meals close to bedtime. You really don't need that leftover cheesecake right before bed. Close the fridge door. Another way to practice good sleep hygiene is to avoid caffeine. Caffeine blocks the receptors that make you feel drowsy, but it also stays in your system long after you ingest it. You should work on associating your bed with sleep. That means no reading, listening to the radio, watching TV, or binge watching an entire season on Netflix. Exercise can also be a healthy way to promote good sleep. 99, 100. It is also important to schedule a consistent bedtime every night. Does sleep hygiene sound like exactly what you're missing? We'll call this number on your screen in the next 10 minutes, and for your 5 easy payments of $29.99, it can be yours. Don't lose any more sleep over this amazing offer. Call now. Coming soon to a theater near you. Lightly based on a true story that has been passed down generations. A man who just wants to get a good night's sleep.
I just want to get a good night's sleep.
And a psychiatrist who just wants to help.
I just want to help.
When medication and sleep hygiene just aren't enough.
Medications and sleep hygiene just aren't enough.
She would suggest a radical solution.
I'm going to suggest a radical solution.
Cognitive behavioral therapy.
Cognitive behavioral therapy?
He thinks it's just for depression and anxiety.
Isn't that used for just depression and anxiety?
No, it can also...
But he would learn that it could also be used to treat his insomnia.
So, it can also be used
Cognitive
for...
behavior therapy can be used for insomnia in a structured program that helps you identify and replace thoughts and behaviors that cause or worsen sleep problems with habits that promote sound sleep. It helps you overcome the underlying cause of your sleep problems. In his debut appearance, Logan Halley is the patient, and co-stars with 5-time Oscar nominee Madison Morris as the psychiatrist.